I went to Lehman College. It's a 4-year City University of New York. 2 years were free, so I know what it's like to have free college. Okay, 2 years was $600 a semester, nothing, peanuts. All right, and because I was able to do that, because my parents were immigrants, I'm an immigrant, I was able to go to medical school. I can't even imagine now kids that are going to medical school coming out with a $500,000 debt. $500,000, and you have to pay that, let's say, over 10 years. It's $50,000 a year. What kind of salary do you have to make to pull that kind of money in? And that's before interest. What kind of salary? So I was fortunate because, yes, I had school debt, but I paid it off, and I was still able to do what made me feel like I was giving something back and helping people who others didn't want to help, because they are, like you said, yes, it doesn't matter, it doesn't matter, they're human beings, they're people. Don't tell me you're pro-life and you're gonna throw these people away because they're garbage, because they don't do what you think they should be doing. Then don't talk about a fetus, because once the fetus is born, now it's not my problem anymore. That's wrong.
You know, on behalf of our international, 2 million members, and but healthcare certainly is a priority within our organization and to our members. Over 1 million of our members are healthcare workers, and about 80,000 are nurses. Our local 1991 is at Jackson, and we represent in the system the nurses, the attending physicians, the other healthcare professionals, about 5,300, and AFSCME represents another probably 5,300, and CIR's there with the interns and residents, about 1,100 residents and interns are organized, and so it's a fairly organized place, and hopefully that gives us a voice to deliver healthcare. And when we talk about healthcare reform in this country, you know, we've kind of got a gift from the voters of Miami-Dade County since the early 1900s, who voted to create a city hospital basically at that time. And Dr. Jackson was dealing with the flu epidemic, and there was no place for people to go. There was no public hospital here in Miami, I'm told. I wasn't here then, but and so they opened arms and created Jackson, the city hospital, and that's Dr. Jackson, and that's that little pink Alamo that exists at Jackson. But you know, and I came to Jackson, I was a graduate of Ohio State and grew up in Cleveland and came down here promising myself to live in the sun somewhere. You know, I think 361 days of cloudiness when I left Ohio out of 365. So we say it's a good place to be from. But you know, this in the 80s was the AIDS epidemic, and hospitals were saying, "Kid, whatever you are, get out of here." And you know, Jackson was like, "We don't know what it is, but let's help you." And it was very cool to see, in partnership with the University of Miami, Margaret Fischel was one of the researchers, that actually today it's a disease you live with, and it used to be a death sentence. So we do good work there, but the most important part is that for whatever reason, the people who vote, 11% of our property taxes goes to Jackson. And then we voted in 1991, when Ira Clark was the CEO and our union first was getting, so we worked hard to get the voters to vote for the half-cent tax increase. The Dade County's been paying 7 cents when everyone else was paying 6.5, and that's been a gold mine. And you know, but Jackson has had Obamacare since the early 1900s. We deliver care to everybody regardless of your ability to pay, and to all residents, not citizens, residents. And the reason why that, I think, model is smart and why it works, and while there's several options to get to healthcare reform today, it's not a light switch. We can't turn it on and we're done. It's going to be whatever we pick and work towards, it's going to be an evolution. It's going to be 10 to 15 years, I would imagine, even if we were all pushing in the same direction, you know, let alone this bipartisan divide that, you know, we get something and then they hack at it, and we go backwards and we, you know, try and fight to get something. SEIU's position on healthcare reform is not that there's any one magical answer. We could do Medicare for all if that's what the country goes to. We could do Medicaid for all. We could do public option. Whatever moves the dial in the right direction and gets us to a place where there's more access to healthcare for everyone that lives here. And every country on earth does this for their citizens. And I had a friend broke his arm in Switzerland riding bikes, went to the ER, he doesn't have insurance in Switzerland, and they said, oh, you don't have insurance, it's gonna be so expensive. And he goes, how much? $150. I mean, you know, it's like, what, when you don't pay for healthcare, I guess $150 of healthcare is a lot. But, you know, it's all relative, right? They would kill for a deductible of $150. But, you know, so it's a shame, but everybody else gives healthcare to their citizens. Every other industrialized nation on earth, we don't. Somehow we've gotten into this niche that we think it's a profit-making industry. You know, and I would compare it right up there with the rights of the firehouse, the police, healthcare, education. We should not be making those profit silos in this country. And, you know, can you imagine, my house is on fire, you have insurance? No, okay, see ya. You know, I mean,
Yeah,
right?
exactly.
It's so crazy. So the reason other countries can give healthcare to their citizens is it's affordable if you give access to all, and you do vaccines, or you do access to primary care. You know, if you need a liver transplant, you're probably gonna send you to this country, right? We do a high end on the sick. We do a great job of sick care and a horrible job on access and prevention. And we've been working with Mr. McGoy at Jackson. You know, he's a banker, so he understands the finances, but he's not the healthcare expert. And the good thing about him is he doesn't pretend he's the healthcare expert. He creates teams to bring us, you know, to a point where we can do it the best. But Jackson forever has been, you know, kind of the place where you go if you're really sick. And people today, even with our improved new image or gorgeous new buildings, thanks to the $830 million bond in October of 13, during the recession, Dade County voters, again, were very generous and voted for $830 million to go to their public hospital. And we did a survey, and 65% of people, whether they ever use Jackson or not, want Jackson to be there. And you know, during the recession, they were gonna chop it up, sell north and south, cut access. And it was really SEIU in 1991 who said, no, 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 not on our watch. We had to convince Magoya, we had to convince even commissioners. You know, I was on Bishop Curry's station a lot, and he said, Martha, which commissioner's not for this? And I said, nobody's saying they want it. They all were trying to figure out how to get out of this $400 million rut we were in, and how do we afford a public hospital. And it's kind of scary when you look at I love many of our county commissioners, not quite all of them, but many of them, and we don't have a real healthcare expert on there. And then you look at our public health trust, there's a banker, there's a lawyer, we have Irene Lipoff as our best, and from
She is the best.
But we don't have a healthcare expert even there. You know, so it's interesting how we do healthcare. So their first instinct in the financial crisis, you know, 08, 10, 11, was to just unload Jackson and privatize it. And this union said, not under our watch. And they, you know, we froze our wages and gave $100 million to Mr. Magoya for 4 years straight, AFSCME and SEIU members, and to keep this place alive. But we said, you can't fail. And you're gonna make two sides of the table, and we're gonna be at that table. And so we've been working with him to shift the cost curve. And I'm using Jackson for an example because it's right here in our backyard. But to me, that's what this country has to do to reform healthcare. If you want to lower healthcare costs, you have to give more people access. We really need that. It's so much cheaper. The rule of thumb is $1 for primary care, prevention, $5 for you go. So when they say 80% of our healthcare dollars are spent on chronic illness, right? If you could eliminate, and we're never going to be perfect and eliminate, but if you cut it in half, the chronic illness, because you gave people access to healthcare when they were young, prenatal, all that stuff, schools, that's much, much, much cheaper, and it's priceless to the human being. So we're just doing it backwards somehow. We've, you know, I don't know if it goes back to far as when we built this country. We built it on the wrong, you know, ideas that, you know, it's a capitalistic world. I don't know what, you know, it's just healthcare. How it got thrown in that bucket and the firehouse didn't, I don't know. It never should have got thrown into that bucket. It should have stayed with the firehouse and the police. You don't need a CEO making millions of dollars. You don't need to make it a profit-making industry. You just need to do it to take care of your people. And by the way, your people are the ones paying you anyway. You know what I mean? We're the ones putting the money in the bucket. And you know, Jackson's always busy. And many people use that for their primary care because they don't have access. So we looked at it, and actually Jackson did a survey, hired a company to come in. 25 to 50% of the patients who come through our ED come there because they don't have access to health care and they use it for their primary care. It's their place of only resort. And if we could find those folks that come there for primary care visits and put them next door in a clinic of Jackson's, you know, we could decompress our ED so it could really focus on who's ever having a heart attack or a stroke or the big things, and people wouldn't have to wait. And so we did this little pilot, and we took the folks, 1,700 patients visit our ED more frequently than 4 times in 6 months. We spend more money than anybody else per person in the world. We're spending more money than anybody else on earth. We're not even in the top 10. You know, it's embarrassing. And I guess the people making the dough are just, you know, big old smiles. I don't know, it's sick. I say we got a good, you know, we have excellent sick care. And we have really poor prevention and wellness. And Ann was giving us a lesson in healthy food tonight. Thank you for the food, yeah, it was nice. But anyway, we can, you know, I think that's setting the stage, I hope.
People that have regular lives are not going to run for office. So when millionaires run for office, do you really think that they represent you? Do they really think what it's like to work 2 jobs so you can pay the bills? Do they really know what it's like not to have affordable health care, or not to be able to pay for that kid's daycare or you know, after school program? They don't know. So they're in Tallahassee and they're like, you know, voting for all this stuff, and it's just to benefit them, their big business, and make more profit. They don't know what it's like to struggle day to day. And I'm serious about this. Until you change that salary, that's exactly what you're gonna get. But regular workers, regular people, we don't know rich people, we don't know millionaires, we don't know people that have a lot of money, you know, so we have to run, we have to struggle to run, and Alina, you know that, you know, to get $50 donations, $20 donations, and it's not enough. It's not enough, because when you are able to raise, 50,000, but then the other guy's got 2 million, you're like, oh, you know? So it's a problem. It's a big problem. And then the other thing we now appear to be doing is that we vilify candidates for accepting money from certain entities. And that's a problem, technically. But I have to tell you this, and you may not know this. If, let's say, FPL gave me $1,000, oh my God, Daisy took $1,000 from FPL. You know what $1,000 is? It's like hush money. Because they gave my opponent $500,000. And so my opponent has $500,000 from HPL, and I took 1,000, but I'm the devil now because I took $1,000 from FPL. And to FPL, that means nothing. FPL is not going to expect you to do absolutely anything for $1,000 because they got their big buddy over there that has 500,000. Okay, so let's be smart about when people are running for office. They need to raise money. And the point is to get there. The point is to win more seats. The point is to turn those seats from red to blue. So I know it's not a comfortable issue to talk about, but hey, I don't have anything to lose, so I'm telling you what I think. When we talk about the priorities in Tallahassee, we need to understand how that money works. And I think we've already talked about money. You know, money it's sort of like the underlying thing that moves everything, right?
Makes the world go round.
You think you're gonna change the world. You know you're gonna make it happen. You know, I'm gonna go and fight for Medicare for all. I'm gonna just do all this stuff. Well, then you get to the process of how you pass a bill. So let's say I want to present a bill on Medicaid expansion. You draft it, and it goes to a place, I call it a graveyard. It's called bill drafting. And I never really knew who those people were. And I never knew what department that was. It's like a secret thing. It's like, Tallahassee's full of like secret societies. I don't think that all Republicans are terrible people up there. It's the imbalance of power. It's when you have too much of something and too little of something, they control everything. So there's no, there's no give and take. There's no negotiating. There's not, well, let you do this, but I'll do it. That doesn't happen anymore.
I was a school nurse for about 10 years, which is why I'm wearing my school nurse shirt today. the fun thing about being a school nurse was that I got to teach classes and I got to work with the kids who I felt needed special attention. And I had fitness clubs, I had jump rope clubs, we had a jump rope team. I just loved being a school nurse because it was so great to have such a mentoring effect with the kids. And I knew they were taking everything I said to heart, and they were taking it home to their parents and sharing information. And a lot of them never saw a healthcare professional except when they had to go and get their immunizations and when they were in school and they could see some of the nurses. I wasn't in all schools all the time, but I worked for the Dade County Health Department, and I was put in, it varied, from 4 to 10 schools per year, depending on what their objectives were. Some years they wanted us to go into the F schools only, and some years they wanted us to go into one particular school district area only. And other years they just wanted us to, you know, have whatever good effect we could have in just 4 schools. Which it was hard to figure out what my bosses were going to tell us from year to year, but it was also wonderful in that I did get to work with a variety of kids. And a lot of the kids I found in like my jump rope clubs and stuff, which would meet before school and after school, they were coming from homes where there was drug addiction, there was alcohol addiction, there was really serious problems. And some of them, you know, if their parents were finding work, it was in the sex industry or other things. You know, they didn't have really great role models. And so I felt like I was playing a really important role in their lives. And that was a wonderful position to be in. Anyway, but the big problem with working for Maxim was that they wanted me to tell the nurses that they were going to have to take a pay cut of $1 an hour. So they were going to go from $15 an hour down to $14 an hour, which was really pathetic pay at that point in time when they could be making $28 an hour if they were willing to work in a hospital. But a lot of them were willing to go that route, even though it was really, I thought, too much to pull an extra $1 out of their pockets per hour, especially because the supervisors, you know, not me particularly, but the other people who sat behind the desks in the office were making like $30 an hour off of every hour that the school nurses were putting in, you know, and it seemed a little bit unfair there. I really enjoyed working in the poor schools better than in the rich schools. The poor schools often were getting F grades and D grades, you know, with our state grading system. But the kids really desperately needed to see a nurse. And if not desperately needing to see a nurse, they needed TLC. They needed somebody to, you know, to understand what they were going through. And I felt like that was way more worthwhile than at the rich schools. Once in a while, I saved a life. You know, I mean, there was one kid who was having an anaphylactic reaction and he didn't have an EpiPen at school. And I would have broken the law. I would have given him somebody else's EpiPen, which is against the law. But I would have done that if I hadn't been able to talk him through to a safe place in his mind. I used, you know, mental imagery and everything to try and get him past it. And he did. He was way less red and all by the time his mom showed up. And I explained to her how desperately he needed an EpiPen at school because he had a peanut allergy and they had been counting peanuts on the other side of the room. But it was just in the air that he smelled peanuts and he had this major anaphylactic reaction.
Wow.
So I kept checking his throat to make sure he could breathe. And he did get better with the guided imagery.
Wow.
And so anyway, it's been an exciting career, but HIV is not my only specialty, and I have felt,
You're a nurse.
yeah, I we've done a lot of different things.
All right. Any questions for Fran? Yadira?
Yeah, and thank you so much for your presentation. I mean, the others were very informative. I learned a lot, but yours was just very heartwarming.
Yeah.
And it's very beautiful. But I wanted to ask, I had no idea that sharing an EpiPen could be against the law.
It is.
I know nothing about that.
They've got to have an EpiPen that is in their name, and it's at the school, and they've got to have one with them at all times when they're on a field trip or something, and they've got to have one at home too. And they're very expensive.
Yeah, I understand that, but let's say at the school maybe a kid forgot his. Maybe there was you can't use it.
You're not supposed to, it's against the law.
Seems so arbitrary.
It's in Dade County, it's against the law.
It's like using a
In
used needle.
Dade County, it's against the law.
I'm a general internist is the last thing. I didn't go into special anything. I just wanted to take care of people. And I'm a preventative health person. I believe that if you prevent the majority of diseases, you don't have to have amputations. You can have that resolved 20 years earlier if you have the resources to do so. That's why I've come to the conclusion that we need to have a one-payer healthcare system in this country, like any other first world, if you want to still consider us a first world country, in the rest of the world has. They take care of their citizens, their people, their residents, and if you happen to be visiting, they will even take care of you for a nominal cost, because healthcare does not have to cost what it costs here in order to be good. And they give just as good, if not better, healthcare, and this presentation will show you that. So I've decided, instead of talking like what Ann did about all the, the heartwarming stories, which is what I used to do, I'm talking about the business case, which is what people have. How much is it gonna cost us? A hell of a lot less than it's costing us now, and much better outcome. But think about 340 billion people having a collective bargaining power. Okay, think of what we can do to big pharma, and the health insurance companies will cease to exist except for extra health care. Like, Aflac or whatever else you want to call it. If you want to have concierge service, you can pay for more. Nobody's ever telling people you can't have more. But we should set a minimum level where everyone is covered from birth to death. And it shouldn't matter where you live, it shouldn't matter where you work, it shouldn't matter what you do. If you get laid off, you have health care. If you quit your job and want to start your own business, you have health care. If your kids are 26 and a half, like my child, one of my children aged up last year, he has no health insurance. And Ann mentioned she's 61, I'm 64, and I don't have health care on my own. If I wasn't married, my husband is 66. He's still working at FIU, and he cannot retire for another year or so until I turn 65, because I cannot go uninsured. I have chronic problems. And see, this is an issue with so many people, and it's just so wrong, especially when you turn 50, 55. If you lose your job, you're screwed. Who wants to hire you at 55? They want to hire a 25-year-old who they can pay half the salary and train them the way they want. And if that one doesn't work out, they have 100 others. It's a revolving door, and it's wrong. Healthcare should be a given right of any resident, I don't want to say citizen, resident who lives in this country, pays taxes, lives in society, because if I don't pay we all pay. There's bad debt. My homeless people go to the emergency room because they have no insurance, a lot of them. That's, let's say, $1,500, and they go for a medication refill. They get a prescription. Then they come to see me when they get in the homeless shelter. Doc, I went to the ER for a medication refill. I couldn't afford the medicine. So now I have to scratch everything I can think of, because I'm limited too as what I can give them, right? To see if I can come up with an alternative, or with something that will cover what they got in prescription, because they don't have any money. That's why they're in the homeless shelter, right? And I don't want to get into the dynamics of why they're in a homeless shelter. Yes, there's many reasons why you end up in the homeless shelter. But needless to say, there are people there like you and me who just ended up in a bad situation. They're not all alcoholics and drug addicts and abusers, and there are some hardworking people, and there are people there who work. Anyway, so I have to give this disclosure that I accept no money. I am not paid, nor do I want to get paid for any of the views that I represent. And this is something that Congress made us as physicians do, and they should do it themselves. They shouldn't be walking around,
Oh,
right?
yeah.
That the lobbyists giving them presentations, they should be walking like NASCAR drivers, right? With all the little, so-and-so paid, blah, blah. Yeah, so I now have to tell you that I have no conflicts of interest whatsoever in what I am about to say. Okay, the definition, we all kind of know what it is: publicly funded, single payer, which we call Medicare for all because people understand what that means. People didn't understand what single payer meant for a long time. We're going to cover the entire population in the United States in this particular instance. Private is what we're used to doing, traditional, where it's for profit. Let's just bottom line, okay? It's for profit. And one thing that I do want to say about the ACA or Obamacare, about the law, is it made private insurers have to spend 80% of the premiums that they collected on direct patient care. Before they didn't have to. So their thing was deny, because the more profits they made, the happier their shareholders got because they got more money. They got more dividends. The CEO got his bonus plus his $40 or $50 million salary a year, which I think is ludicrous, plus all his stock options and everything else. So their goal is to make money. That's what private is all about. Even private schools, right? Charter schools. But that's another conversation. I know, I don't wanna go there either because, we're number 53, yay. Public,
Part of the whole same system.
yeah, I know it is. Public health care is basically what we have with Medicare, with the VA, Medicaid. The public finances these three populations, for example. But if we decide to go with single payer, which makes sense, then there's only one system. Everybody fits into the single payer. VA is part of that, Medicaid is part of that, because people say, where are you gonna get the money? But we already have all these things that we're paying money for. The money just goes into one kitty. We have even workman's comp. A lot of businesses, small businesses have trouble paying the amount that they have to pay for workman's comp. That goes away. Now a small company can budget, right? Can budget their next year because they don't have to worry about health care. They're not paying this. We, as all of us, are paying for this. Okay, so again, it eliminates private insurance, but like I said, I'm not telling Aetna that they can dissolve. They can still cover people who want more, who want extra, who want concierge service, who want, the private whatever, that's fine. But the point here is to cover everyone with a minimum amount of standard basic health care. If you have an ear infection, if you have pneumonia, if you have high blood pressure, if you have diabetes, basic stuff. Yes, if you need a heart that is still factored into the system, but as you will see later on, 80% of healthcare dollars now are going to, I think it's 10% of the population. So 90% of us use only 20% of the funds. But that's how it's supposed to be. That's how insurance works, isn't it? You pay for everyone, and you don't. If I don't have an accident this year, so let me go to Allstate and say I want my money back. Okay, infant mortality. You would think that with all the money that we pay for health care, we should have the lowest infant mortality in the world, and we don't. Canada, Australia, yeah, even Cuba, Australia, but we're talking about first world, we're talking about Australia, Germany, countries that have capitalism, democracies, whatever you want to call it. France, Italy, Sweden. Okay, hey, take me to Sweden. Maternal mortality, same thing. So why are we having these bad outcomes compared to other countries that have one payer health care? Everyone gets covered under the same system. Why do we have worse outcomes if we're spending so much more money? Don't listen to what the politicians tell you. This is why we need to have more people coming to these meetings, okay? And Republicans as well. Because we know that Mario Diaz-Balart's constituents love him, they listen to him. We know this, so we need to change that. The number one cause of bankruptcies in the United States is medical costs, number one.
Oh my God.
2 million, and that's not counting people who are too poor to have anything to take. Okay, that's what it says here. 62% of Americans file cases, 866,000 total, affecting 2 million, excludes those too poor to declare bankruptcy. If you got nothing,
That was 10 years ago.
they can't take
Pero
nothing
dice
away from
double
you,
the amount
Yeah.
right? And if you have nothing to bill, like the homeless people that I take care of, good luck the ER billing them the $1,500. First of all, they gotta find them, and then if they find them, they got no money, they got no assets, they got nothing. So that's where the bad debt comes in. So we're all paying anyway for this system that hasn't worked in 30 years. Physician visits per capita. Wow, look at Japan. They see their doctors a lot, don't they? We only see like four visits. Only 4. So why are we having such bad outcomes? We say, oh, people are less sick, that's why, right? But we know that's not true. 13 visits per capita in Japan. And you're gonna see later on that they have a higher rate of, they die older, they have better quality of life, everything.
And food, and no pesticide in their food and
Well,
nothing
that's
like
another, let's keep talking about health insurance.
Hey, Suchi.
Is it a moral hazard because patients don't have enough skin in the game? In other words, we don't have enough money. We don't have enough of our blood, sweat, and tears into it. We know the answer is, we know, okay? Deductibles are rapidly increasing. We all know that this is true. Yes, the ACA was wonderful for a lot of the things it's done. But they have done everything that they can in their mother to break it down, to try to make it fail. And it will fail. It's going to fail. Because the last thing was the individual mandate. If you don't have healthy people paying into the system, the unhealthy people cannot afford health care. Just like if you don't have people who have no accidents paying into the auto pool, right? And yes, I know that they have high risk pools, whatever, but you get where I'm going with this. Okay, so percent of worker deductibles. We started in 2006. It was greater than $1,000, and to me, that's already a damn high deductible. You're making $22,000 a year, shucks, right? 10%. We're all the way up to 38% and that was 2013, so I'm sure it's gone up even more. More than $1,000 deductible, because we know that the better the plan, the less deductible, but the more the cost. So you end up getting the catastrophic plan of the ACA or the bronze plan, which gives you like a high deductible and a high copay. We know this guy that was gonna come today who had leukemia last year, and it was $6,000 deductible. He couldn't afford it. Thank God he's still here, he made it to Medicare.
We had to do a GoFundMe in order to be able to save his life.
And now he has Medicare, so, thank God, right? But imagine if he didn't have the abilities to do GoFundMe, he didn't have friends who cared enough to help him reach that deductible, he would already be dead. That's not fair, that's not right. And yes, I know life is not fair, I know that. But it shouldn't be not fair in that way that you have to die because you're poor. Or you have to die because you don't have enough, that's not fair. We're spending twice as much, we're underutilizing, not overutilizing care, and our health outcomes are worse. Why are we paying so goddamn much money? Then what is costing us so much more than other countries? Remember that $504 billion I told you in the beginning? Okay, I'm gonna start bringing that up now, because that's not direct patient care, okay? This is the problem. When I graduated from medical school, right about here, I already started seeing the increase. But look at the number of physicians over 40 years and look at the number of administrators. I feel like I'm carrying 20 people on my back. This is where we say paperwork. Simple paperwork. One payer healthcare, you eliminate the 25,000 plans that there are, the person having to call to approve or not approve. I have to, $504 billion, and by the way, this number, because Lorenzo told me, is not just proven by us left-thinking people, but the Koch brothers agree that this is a true number that we will save on administrative costs if we get rid of all this system the way it is.